So this is one of the patients that we're trying to help. The name is Pear Lemon, not the Pear Orange or Pear Apple. No, I'm kidding. He's from Jakarta, Indonesia. He actually, his parents didn't admit him as their children, so he doesn't have a birth certificate. That make it very difficult for him to have national insurance, the BPJS. Okay, so at one point in the life, he needs some immediate medical treatments for, I think it's only like 15 million. It's not really high, but it's still very difficult for them. Next. But I believe that there is no condition is permanent. Even though for the most desperate patients like Perlemon, they will still do something to acquire a fund for the healthcare. What other options that they have for patients like Perlemon? The first is they will look for a loan. It could be from the hospitals. Hospitals actually can give you a loan. Or they can go to the neighbors and the families sometimes to give them some loans, but it's still burdening them because they still need to pay back the loan after they got back from the hospitals. And it's very, very difficult for them also. And also for the hospitals, if the hospital give the loan, it will create a loss. Like one example is one hospital in Bandung, they spend 50 billion only to pay, like in the course of 5 to 10 years, only to pay for those kind of patients. So it's a big loss for the hospitals, as well as a burden for the patients. And the second one, they might do fundraising, but it's still via the scattered channels. It could be through WhatsApp groups or BBMs, which lacks of transparency. And if they're lucky enough, some mainstream medias like Detik.com or televisions might expose them, but it's not for all of them. Like they only show that, you know, if this is not dramatic enough, there's no way.
It depends if the story is good or not.
Yeah.
Is it dramatic?
There's no way it will be exposed by the mainstream media. So if those two options fail, they'll be like, as you probably already familiar with, pulang paksa or forced to go back from the hospitals, something like that. And we want to at least minimize that to happen. So next. So we do this as a new layer of safety net for the patients. So it's a crowdfunding model. Basically, you can go to our website. There will be patients in our sites. You can choose which patients you want to help. You want to donate as little as 25,000 rupiahs. And we also have a universal fund with actually, because there's a lot of patients on our website, if you're confused of which patient that you want to give, basically you can just deposit the money to us, and then we will channel based on the level of urgency or the immediate request from the hospital, something like that. Next. So this is how we work. The first time we worked, we kind of ask our friends in the medical community, like from internship doctors, or probably from the COAS, they supply us with the patients, and then we crowdfund them. But along the journey, we prefer to work with the hospitals. So the hospitals basically have our system. They submit their patients, and our job is to approve or reject, or probably, and then crowdfund them to the public. And afterwards, we transfer the money to the hospital because it's more accountable and more transparent. So that's kind of how we work right now. Next. Of course, we take revenue stream because like it's hard to maintain these platforms. We need to be sustainable, and we try our best to create a business models that will work out of that. Now that we are implementing a 10% management fee, but we don't cut it out. Most of the crowdfunding platform like kitabisa.com will cut it out, but we don't cut it out. So we add it. So for example, if patient need 10 millions, we will add 1 million for our revenue. So we crowdfund for 11 million, something like that. We also have other sources of revenues. We're usually in a profit sharing model. So we do like collaborative campaign with brands like Uber or GoGlams or Gojek, something like that. We do a good cost campaign, something like that. And for every item sold, they will share to WeCare.id. Yeah, kind of that. Next. Yeah, we're still very young, pretty young compared to Kitabisa, who has been like 4 or 5 years. We still have 1.5 years so far. And we've quite have a lot of tractions. So far, we've there are like 1.76 billion rupiahs donated to our platforms, and then we have funded more than 186 patients from across of the countries, from 15 provinces in Indonesia. That's a very humbling traction for us. We never expected that it will be this huge at this short time. So the hard job. Next is more to maintain the tractions and make it more exciting. Next. Yeah, so we try to find what is actually the best legal models for us, because like we are part of want to do good and part of one sustainable, which is probably only happen or only best implemented if we do this in the business in a business legality. So now we have two legals. We ultimately aspire ourselves as a social enterprise. We're probably not really full of social enterprise right now. We're still in that spectrums. We are non-profit, but we have revenue generating models, and part of our funding is probably still from grant or something like that. But we hope we can really move forwards to shift the spectrums in a social enterprise, so we can be fully operated social enterprise with the most robust business models and be sustainable with ourselves, something like that. Yeah, so this is our ambition. That's what I mentioned in the beginning, that our quest is more in the healthcare, not in the donation platforms. So basically, we just want to, what's actually the most ambitious target in healthcare? What I see in the future is healthcare is, the future of healthcare is, there are two futures of healthcare. The first one is personalizations, and the second one is accessibility. But you cannot go personalization without ensuring the accessibility. So, and we don't have, I'm not confident enough that I have a good expertise in terms of achieving personalizations, because it's more, creating personalized medicine for diabetes or personalized treatment. It's very, very advanced in terms of technology and in terms of the knowledge. So we prefer to, but what about the ensuring technology? Because I know a lot about digital health, and my co-founder is also a medician. So right now we're focusing on building the ecosystems. We want to ensure that there is other alternatives to solve the financing issues in the healthcare systems, and we want to connect as many as hospitals under our platforms. And afterwards, we're going forward to accelerate the use of digital health, because like, even though we are succeeding in providing the ultimate financing for healthcare, like as big as BPJS, for example, we want to be able to ensure that that people will still get the best facilitations for the medical. If we do not ensure that the facilities for the medical is also spread equally across Indonesia. So, and it's pretty much expensive to build something physically like hospitals. So we probably can enable the use of digital health, like Bakrenat Kasali mentioned before, like the telemedicines, which the doctors doesn't necessarily have to move to other islands, or you don't even need to build like fully working hospitals in islands. As long as the computer or something working there, it's going to be very, very good to provide more access to the medical, as well as to make the process more efficient. Because there is a lot of inefficiency in healthcare, something like that, and this costs a lot. So we want to minimize the inefficiency and make our process more better and cheaper. Next. Yeah, we've been very helpful. We've been very, very humble to be. There's a lot of sponsors, companies, or something, endorsers, something like that, who see that we are doing good and help us to spread the awareness to a larger audience and beneficiaries, something like that. Yeah, it's been wonderful.